This conference will now be recorded.
Okay. Okay, sorry, it's not loading well.
Kyla, I can share my screen and pull it up. You would just have to tell me what slide to move it to.
Okay, I can do that. I think that might be best.
Okay.
Sorry.
It's okay. So I will share my screen. We'll do the entire screen and share. And we'll minimize that. I'll pull this up, and this is under PHE, preliminary results presentation. And then we're going to go to view, full screen. Okay, can you see that, everybody, on the GoToMeeting?
Yes, that looks good. Thank you.
Okay. So you're all set.
Okay, awesome. Thank you so much. Apologies for the technical difficulties. My name is Kyla and I'm a consultant with BME Strategies. And I've been working closely with folks from the Office of Local and Regional Health in the Performance Standards Unit to roll out this foundational public health services shared services review. And Andrea and the members of the Quabbin Health District completed 2 tools as part of this review process. And so we're going to share some of the preliminary results tonight. And with me today is Cassandra Anderson, who works in the Performance Standards Unit at the Office of Local and Regional Health. You can go to the next slide. So this is just an agenda. We will go through the purpose of the FPHS review in this presentation, and then we will go through some of the preliminary data and then go through the data to action toolkit. And you can go 2 slides ahead. Okay, so the purpose of this evening's presentation is to provide some actionable insights that align with your long-term capacity goals, with an emphasis on improving and enhancing the foundational capabilities, which are part of the Foundational Public Health Services Framework. And the goal of the presentation is to really understand how the Foundational Public Health Services preliminary data can guide decisions and support each stage of planning and capacity building. And the FPHS implementation process is really a stepwise process that the state knows will take a really long time to fully adopt in Massachusetts. And data from this review is not punitive in any way. It's not in any way an evaluation of your performance. It's really just a way to measure where local public health across the state currently stands in reference to this national framework of the Foundational Public Health Services Framework. You can go to the next slide. So this slide is just showing an overview of what the Foundational Public Health Services Framework is. So this was developed by the Public Health Accreditation Board in collaboration with a national network of public health leaders. And it's a national framework, so there are aspects that maybe don't fit 100% perfectly with the state of Massachusetts and the local public health system that we know. But it was recommended for adoption in the Blueprint for Public Health Excellence, and it was also written into the SAFE 2.0 legislation. And so this framework is made up of 5 foundational areas, which are shown in the light blue or teal circles. And these are things that we really think of when we think of public health in Massachusetts, the core programs and functions. So things like environmental public health, which encompasses things like inspections. And then communicable disease control, so things like vaccine clinics and access to those. And then there are 8 foundational capabilities, which are shown in the navy rectangles down below. And those are the skills and functions that support public health programming. And so these are things like organizational competencies, which include like writing meeting minutes and organizing things and any sort of administrative work that goes into making all of those foundational areas possible, as well as things like equity and communications that really help to facilitate the delivery of those foundational areas. You can go to the next slide. So this is just an overview of everything that is in this presentation, which is shared with Andrea and she can make available to you all after this evening. We will only be going over the first 2 points, the preliminary spending and foundational area capability data and some of the data to action toolkit items. But if you choose to look at it later on, there's also a data interpretation guide that really highlights how to interpret each of the figures that are shown in the presentation. And there's a data appendix that just goes into more detail about the data at different levels. Next slide. And then you can go to the next slide. This is just some information about the preliminary data, highlighting that it includes jurisdictions that completed both tools that were utilized in this review. So there was the service delivery tool that collected information on the capacity and expertise of your workforce in the Quabbin Health District to deliver the outlined services in the Foundational Public Health Services Framework. And then there was a cost tool that collected spending and revenue data from FY24 and saw how much you were allocating to each of the Foundational Public Health Services foundational areas and capabilities. And so all of the towns in your district participated in this review process with the help of those shared staff in the Quabbin Health District who filled out the tools on behalf of all of the towns. And you can go to the next slide, which is just highlighting basically the same thing, showing that you all have 3 towns in your shared service arrangement, and there were 4 entities that completed tools, since there is also the Quabbin Health District, which completed their own cost tool and service, and then portion of the service delivery tool as well. Since the Quabbin Health District has independent funding outside of the 3 municipalities in the district as well. And you can go to the next slide. So this is just showing some key takeaways that's describing what will be shown in the next slides. You can go to that one. So this slide is showing some of the overall spending data for your shared service arrangement or Quabbin Health District in fiscal year 2024. So this is the spending across all 3 of the municipalities. One of the municipalities had someone who worked there part-time that was not a shared staff member. And so it also includes money spent on that individual, as well as money spent on any of your Board of Health stipends or things that individual boards of health in any of the 3 communities spend outside of the Quabbin Health District funds. And it also includes all of the money spent in FY24 from the Quabbin Health District on services that were provided to all 3 of the communities in your region. So overall, you all spent $587,000, and this 52% of this spending was from grants, one of which was the Public Health Excellence Grant. And you had a total of 4.9 FTE or full-time equivalency, and 3 out of 4 of those positions, and or more than that, 4, it looks like about 4 positions were regional staff positions. So this includes some office and administrative staff positions, an environmental health worker, local public health leadership, and a registered nurse. And so all of those folks are providing services to all of the communities in your district. And then you can jump ahead 2 slides. So this is showing some additional spending data broken down by foundational area and capability. So before we saw the total amount spent, and then here we're looking at the total amount spent on those foundational public health services. So it's about $700 less that is spent on the foundational public health services, and that $700 that was overall that's taken out of this slide was spent on community specific services. So that's anything having to do with one community specifically or individual things in the community, and anything having to do with trash or recycling or waste management also is considered a community specific service. So that is not captured in this foundational public health services spending information. And we can see that your highest spending category, so the foundational capability where spending was the greatest in fiscal year 2024, was on organizational competencies, followed closely by environmental public health. And then that was also the highest FTE allocation. So the most staff time was allocated to things related to organizational competencies, followed by environmental public health. And you might be thinking, what is organizational competencies? So one reason why that might be high for your health district is because first of all, there are so few staff that the Board of Health stipends increase that money. And so according to the Public Health Accreditation Board framework, any Board of Health stipend automatically falls under organizational competencies. So that likely increased the spending and FTE in that category. Additionally, there are some administrative staff, about 2 FTE total were dedicated to administrative or support staff, and most of their time is also likely dedicated to organizational competencies. So that's thinking about things like writing meeting minutes or organizing things. Any secretarial or administrative work falls under this category in the Foundational Public Health Services framework. You can go on to the next slide unless there are any questions about this slide. Okay, you can go to the next slide.
This is Bill Pula from Pelham. The 586 is the sort of our budget, the Quabbin Health District budget that's paid by the 3 towns plus the grant money, right?
Yes, that's correct.
Whatever budget the individual boards of health have collectively.
Yeah.
I imagine. Yeah.
Yes, that's correct.
Okay.
So in the service delivery tool, you all were asked, or the Quabbin Health District staff were asked to rate the capacity and expertise for each of the headline responsibilities or different services that are outlined under each foundational area and capability. And the capacity and expertise was ranked from absent to comprehensive. And when you're thinking about capacity, that refers to things like staff time or resources available. And then expertise is thinking about things like education, training, skills, credentialing, or experience. You can go, and so the next few slides are going to look at your capacity and expertise distribution. You can go to the next slide. Oh, next slide. Sorry, thank you. Okay, perfect. This one's good. So this is looking at the, oh, sorry, you can go back. That was my bad. Okay, thank you, sorry. This is looking at the capacity and expertise distribution of the shared staff. So this is folks who work for the Quabbin Health District and serve all 3 communities. And so here we can see that the highest capacity and expertise area for the shared staff are really in a lot of foundational areas and capabilities. They rated themselves very high in most of those areas, including things like equity, access to and linkage with clinical care, and organizational competencies. And then some areas where their capacity and expertise is more limited are in maternal, child, and family health, and communications are a bit lower, closer to that left-hand corner on the screen. And you can go to the next slide. So this slide shows the capacity and expertise distribution of the folks who work in just one municipality, and this is including the capacity and expertise estimates for folks who are on the Board of Health, and showing that the capacity and expertise is more limited for folks on the boards of health is not saying that you're doing anything wrong. It's just highlighting that you all are essentially volunteers, and the reason that your capacity and expertise is low in a lot of areas is because you're relying on the capacity and expertise of the shared staff, which was shown previously. And those shared staff are able to really meet the needs of your community in a lot of foundational areas and capabilities, and they're utilizing their capacity and expertise to adequately serve the 3 towns in your district. You can go to the next slide. So this slide shows the capacity and expertise. I know it looks overwhelming. Everyone says that this looks very overwhelming from the get-go, but there's 13 different scatter plots, one for each foundational area and capability, and it shows the capacity and expertise for the shared staff next to that of the boards of health, or folks who are only working in one municipality in the district. And so the boards of health are shown in the orange circles, and it's averaging the capacity and expertise from all 3 communities. And then the shared staff are shown in the purple rectangles or squares. And so we can see here how the capacity and expertise for the shared staff is quite high in most of these foundational areas and capabilities. And their capacity and expertise is being shared across all 3 communities. So all of the communities have access to the high capacity and expertise of those shared staff. Are there any questions about these capacity and expertise slides?
Yes, in the upper right corner, I cannot read that, but that seems to be the lowest for both the shared staff and the local staff.
Yeah, that's a good question. Thank you for highlighting that. That one is maternal, child, and family health, which is low for pretty much every shared service arrangement or cooperative across the state, because maternal, child, and family health isn't something that local public health in Massachusetts has historically been responsible for. And that doesn't mean that there aren't maternal, child, and family health services in your communities. It just means that they're not being delivered by the health department specifically. But it doesn't mean you're doing anything wrong. If there aren't any other questions, Andrea, if you could jump to slide 35, please. Oh, a little too far. Back. It's the one that says environmental public health. So back further.
Have it, Kyla.
A few more back.
Because it jumped.
Yeah.
Just continue to go backwards?
Yeah, you can just go backwards. It's a few more. They're in alphabetical order. So it should be the one, I think, before this one, before equity. So this one, perfect. This is perfect. Yeah, perfect. So as you saw from jumping through the slides, there's a slide that looks like this for each of the foundational areas and capabilities that breaks down the spending and FTE and capacity and expertise, and then some additional information about each of the headline responsibilities. There's a page that looks like this for each foundational area and capability. And then prior to these slides, there's also a slide that looks like highlights some key summary points. So if you don't want to look at the figures and instead want to read the bullet points, you can do that as well. So we're just going to spend a minute looking at your environmental public health data. So here we can see that overall you spent about 26% of your overall spending on environmental public health services in fiscal year 2024, which makes a lot of sense since environmental public health is something that local public health in Massachusetts has historically been the most responsible for, and it is the foundational area that aligns most closely with the performance standards. So it makes sense that a lot of your spending is going to environmental public health services. And then about 26.5% of your FTE is dedicated to environmental public health services. So this is thinking about things like time spent doing inspections would be dedicated to this FTE in environmental public health. And then the figure in the center of the capacity and expertise is the same as what we looked at before, showing the capacity and expertise distribution of the shared staff versus the Board of Health staff. And so we can see that the shared staff indicated having moderate capacity and expertise in environmental public health. So that is good. They're able to really support all three of the communities in your district. And then the figure on the left-hand side is the most confusing one that I'll walk through a little bit more. So there's these 6 headline responsibilities that are listed on the far left-hand side, which span from things like developing a plan to promote environmental health to the nitty-gritty of actually conducting environmental public health inspections. And we can see in that SSA column where it's purple all across, and it says 3 all across the board, that the shared staff, so the SSA, is providing those environmental public health services or headline responsibilities to all 3 communities, and they're providing all of the headline responsibilities to all 3 of the communities in your district. And then they have also indicated for all 3 communities that the needs of those communities are being mostly or completely met. So as a result of that high capacity and expertise of your shared staff, they're really able to meet the needs of your community and do things like developing a plan for environmental health and conducting mandated environmental public health inspections. Are there any questions about this or the displaying of the data?
Again, from Pelham. I don't know. I can't read any of the slides, so this is, it's we should have handouts or something, because I can't read anything except for environmental public health. Everything else is too small to read, right? So I don't understand what it is even you're talking about. What is environmental public health? It's restaurant and housing inspections, septic systems, wells. What is it?
Yeah, it's really any inspection. So in the Foundational Public Health Services framework, they don't get to, it's really, it encompasses all inspections. So most of what we think of. So the definition that it says on the slide is monitor data on environmental health and develop and implement population-based programs, strategies, and policy, enforce related public health laws to meet health and safety standards, conduct related inspections to protect the public from hazards in accordance with federal, state, and local laws. Environmental public health focuses on the ways in which the natural and built environment affect human health. This includes factors such as the quality and safety of food, air, and water, as well as the safety of buildings and other recreational areas and infrastructure, including but not limited to pools, septic, camps, restaurants, beaches, events, housing, yards, and solid waste disposal.
Have one comment, like the total spending for that includes the staff salary. So it's not just what we've for like supplies, inspectional supplies. It includes the salary as well. And I think
Thank
Ken,
you for that
you had a
clarification.
question.
I find it kind of all for the boards of health and every one of them, you have was 0, right? You get nothing.
The
boards of health
0.
spending. Go ahead.
Oh,
I think it's a weird revaluation. I think I'm just saying. I don't agree with it.
Noted. We'll put that down in the meeting minutes, Bill.
Kyla, do you want to explain the difference and why that is for a health district in Massachusetts?
Yeah. So essentially it's because your inspector, so the person doing the inspections and who's like paid to do those inspections, is paid through the Quabbin Health District. So anyone who works for the Quabbin Health District or is considered a shared staff wouldn't be noted in that LPH column. They would be noted only in that SSA column or shared staff column. So the towns aren't doing anything wrong. Like, you all are essentially one town working together which is why you're a district, and you're pooling your resources and have these staff who really act as if they're providing services to one community. It just happens to be 3 communities. And Cassandra, if you have more to add, please do.
Yeah, that's a great explanation. And LPH here is to represent each individual local public health entity at each municipality in Massachusetts. Since we do have so many different ways that public health services are provided, we have a column for the individual local public health entity, a column for a sharing of services, that's SSA, which you have full sharing of services on environmental health, and then a column for a different type of external partner that might provide that service. And that's very common that only one or all three are being used in Massachusetts because of this infrastructure that we have here. We have a lot of different ways that public health services are provided. So it just gives you a sense of who is providing the service, not that there isn't a service provided. Under Met Community Needs, you are reporting that you have met all of the needs for environmental public health that your communities have in all three communities.
Bill, why public health entities are like absent? Oh, I think that what we're seeing on our end, I understand. What we see is it looks like there's no expertise at all in any members of the board, which some people on the board do have some things that they know, but I think that's what you're saying, right, Bill? Yeah. Yeah. Well, Andrea has her hand up, so what do you have to say, Andrea?
I filled out the survey. A lot of those questions were asking more about like the services. And so for an example, the local boards of health provide an animal inspector through your board of health budget. So if there was questions about providing animal inspector, barn inspections, rabies control, we would see 0 under shared service arrangement because the Quabbin Health District does not provide those services. It's through the local board of health. And that's where you might see some action in that local public health or local board of health column. It really isn't. What I'll do is after this, the survey we had to take was really long and extensive. I can send that over so that you can see the questions that were asked. And
that resulted in these answers.
Right.
That would be helpful.
Yeah, I think
there is some additional explanation in the appendix of the presentation. After you look at it, you'll be able to go to the appendix. But I agree, Andrea, it would be helpful to send out the full question list so they can understand where it comes from.
It was sent to me. Myself and Kirsten filled out the public health services because a lot of those questions had to do with like disease prevention, public health nursing, and then there was a cost analysis tool that Mary and Betty filled out specifically for those boards of health budget, and I filled out one for the Quabbin Health District. So I had multiple staff working on that. And you'll see when I send you the survey, a lot of the questions that are asked, it's I had a little bit of a hard time filling it out, and I had expressed that to Kyla, the way that the questions were worded and asked. I had help with Kirsten filling it out to see like, okay, are you providing this? Is this? And you'll see it wasn't something, if I sent it to everybody ahead of time, I think it would have just been too much. It would have been overwhelming. This is kind of analyzing those results. Yeah. Yep. And you'll have this.
You'll provide us.
And you'll have the slides too. There's, I think, 98 slides that you can go through. Okay. Whenever you're ready to move on.
Okay, I know we are kind of limited on time, so if we want to jump to the overview and not review another foundational area or capability, that's okay with me. It's up to you. Andrea, or if you want to look at we were going to look at assessment and surveillance, but folks can look at that in their own time as well if that's preferred.
See it anyway. Maybe if we just get to the summary and then we can look over it and then we can discuss it at our next meeting if we have questions. Thank you.
Yeah, totally. So the summary slide is on slide 44, so you can go forward some. So right here, oh, back one. Okay. Perfect. So this is just the data to action summary slide and highlights some key points. So this first point is just highlighting the two foundational areas that align most closely with the current performance standards. So those are environmental public health and communicable disease control. And we looked closely at environmental public health, which your district is doing very well in and really meeting the needs of your community, which indicates that you're also meeting the current performance standards. So that is excellent. And the second point is highlighting an area where capacity and expertise for the boards of health is quite high. And so that can be really leveraged to support the district overall. And that's in policy development and support, which also makes a lot of sense since boards are typically there to really make policies and provide support to the folks who are carrying out those day-to-day health district actions. And so you all are doing a great job and have high capacity and expertise in that area. And then the third little rectangle is showing two areas where there is more limited capacity and expertise for the shared staff and the local boards of health. So this is in assessment and surveillance, and then in communications. And so the communications one is pretty common across the state, just really working to enhance communications infrastructure and things is something that folks are working on over time. And then the assessment and surveillance, the reason that the capacity and expertise for that one appears low is not because the folks at the Quabbin Health District are doing anything wrong. It's really just because two of those headline responsibilities under that area fall on organizations outside of the district. So they fall on folks like at the Department of Public Health or other agencies within the municipalities. And so it's not saying that the district is doing anything wrong in the delivery of that foundational capability. It's just highlighting that they don't have the capacity or expertise because they don't have to do all of those services. And then the area where there really currently aren't any services provided and community needs were not met for any of the headline responsibilities is in maternal, child, and family health. But once again, as we talked about at that beginning part when we looked at the capacity and expertise, this could be because external organizations are providing maternal, child, and family health services. You can go to the next slide, Andrea. And then the next slide again. So this is just highlighting the timeline and toolkit. So this slide shows the 3 resources that are available to support you all in continuing to think about the foundational public health services and this review process overall. So the first resource is the FPHS Work Plan Crosswalk, which provides some information about how your Public Health Excellence Grant work plan really aligns closely with the Foundational Public Health Services Framework. The second tool is a partner mapping template. So this provides some guidance on acknowledging and making note of any partners in your area who might be providing some of these headline responsibilities outlined in the Foundational Public Health Services Framework. And then the last resource is a discussion facilitation guide. So this just provides some questions and discussion prompts to continue the conversation about FPHS so that you all can keep talking about this and talk about how to increase your capacity and expertise in different areas and grow as we transition to adopting these as the performance standards for Massachusetts. And then there's just one more slide. So this shows the data to action support team. So if anyone has any questions about the data or wants to meet to talk about it, you can submit a technical assistance request form, which will go to OLRH, and then you can be paired with a subject matter expert from MHOA to go through your preliminary results, or you can meet with my team from BME Strategies or folks from the Office of Local and Regional Health, whose names are listed on the screen. And we are happy to continue these discussions about your preliminary data and how to really implement FPHS in your district. Are there any questions? Cassandra, you unmuted.
Yeah, I was going to add that before each of the data visualizations, there's a slide that provides an overview of the results that are being shown. So there's several bullets that just say, what it is that's on that visualization slide, the next slide. And then as well, towards the end of, like after this part of the presentation, there's several slides that help to explain what each of the visualizations means. Like, what is it about? Where does the data come from? And what does that mean? So that it's easier to interpret what are on those main slides before you would get to even the appendix. And then the appendix has a full breakdown of the data from answering the questions. And so if you have additional questions on either the results slides that provide summaries on each of the foundational public health services, or you have more questions on that additional appendix that gives you a lot of data in many tables, then yeah, please reach out to us. We would be happy to explain it in more detail. I know this wasn't, I think, the right presentation size for the setting today, unfortunately. But I hope that you will look through the slides on your own time and come back to the next meeting to discuss them.
Yeah, and also just want to reiterate that really the results show that your district is doing a great job, and the staff that you've hired to do the communicable disease work and environmental public health work and any other work that supports all three communities, they're doing what they're supposed to, and this data really supports that. So I know it's confusing, but it's really just showing what you likely already know.
If I might, this is Ken Elstein, Belchertown. I might suggest that there's a huge information that you provide, and I haven't seen this these slides before. It would be really helpful at the end, place prove or where we have the right amount of expertise or not, which we haven't gotten in today. This may be a good product for what you need. Us more specific. Fairly smart.
I'm having trouble hearing. I'm not sure if, Cassandra, you heard that or if it's everyone. Okay. I
apologize, Gail. We can't see the go-to meeting people, but if there's anyone on the go-to meeting that has a question, yeah, we can do that.
I don't have any questions, but I was having trouble hearing. But if there's information to come following this meeting, I'm happy to take a look at it.
Okay.
Information to come, so you can get that. Can you hear us here, Gail? Oh, you can just nod your head yes. Can't see her now.
I can hear you, whoever's speaking now, and we can hear some other folks. Maybe there was an issue with that microphone.
All right, perfect. So the next item on our agenda.
Thank you.
Very much for your presentation, Kyla. All right, so the
We're moving furniture.
Into our excellence grant. Yep. So I like putting things up on the big screen, but just so everybody can see it, because some folks I'll minimize this and open this.
I do not recall seeing the survey.
I remember seeing the survey. Maybe it was.
Okay.
I followed it, but I left work to come here.
So this should look familiar. You all have that handout in your packet.
Yep.
The left side is what was approved for FY25 when we did this last year in June. And then that's just, I like to compare the two fiscal years together. We're getting the same grant funding that we did for FY25 and FY26, and that's expected to go through into FY27. So the end of June of 2027, we should be getting the same amount. But on the right, this is the proposed budget. It is similar to the other one. I won't go through each line item, so I guess if you have a specific question on something.
Does anybody have any questions, or has everybody had?
You got those two numbers, and they come to 176 plus 148.
So the subtotal for personnel is the 176, and then all the other operating costs were 148 with the total of 324. Yes. Yep, the personnel is our public health nurse. This is the salary adjustments for the staff salaries, and then the administrator clerk is Desiree's position for the support staff. That's personnel. And then the fringe is the nurse's benefits because she's full-time, and then it's the payroll taxes for both the nurse and the support staff. And then that's the total. Oh, yes, if you do talk, just put your microphone on, just so people on the GoToMeeting can hear. As far as money giving back, to give you an idea, in FY24, we sent back $44,313.13 in unspent funds. This fiscal year, probably plus or minus close to 20,000. I'm doing my best to kind of spend it down, but that's good. And then again, this is our proposed budget. Typically, during the fiscal year, like for Rogers, we budgeted for $45,500. He's up to $48,500. So we had some money, remaining in some of these other line items that I did a budget revision request to transfer into his line item to support that. And then that's why I'm proposing a little bit more for FY26, just to give you an example. So it does fluctuate a little bit during the year. In case we run low on nursing supplies, I can adjust things to either add more money into the nursing supplies from something that might not be used as much. But for the most part, things pretty much stay the same.
All right, anybody got any questions about that?
So do we want to do a motion to approve the FY26 budget for the Public Health Excellence Grant?
If I may, I move that we approve the fiscal year 26 Public Health Excellent Grant budget.
A second?
All in favor? Aye.
Gail, did you have any questions?
Oh, I didn't see if Gail was in favor. Are you in
Can't
favor,
see her.
Gail?
I'm not sure I'm one of the. Hello?
Yeah,
Sorry.
We can
We can hear you.
Okay, great. I'm not sure I'm one of the voting members from Belchertown. I'm just started my term.
We all are, and we only have 2 other people sitting here, so you actually get a full vote.
Oh, okay. Thank you for that clarification. It's a little hard to see everybody in there, and I apologize for not being there in person, but I've had a cold and didn't want to share germs. No, I don't have any questions, and the budget looks very reasonable to me, so I would vote in favor of it.
All right, so it's unanimous.
And then the next slide, the last year we ended up doing a project with the Public Health Excellence Grant that Pelham wanted to do regarding the private well testing. We're just wrapping that up now, and Desiree is going to be reporting the results to the individual Board of Health at their meeting. But this fiscal year, I offered it to the town of the Ware Board of Health to see what they wanted to do for a project, and this is what we have. We're going to be doing like a diabetes screening kickoff for the district. That's a service that we have not provided before, so we'll need to order some new supplies in order to do this for the district. I do have Kirsten here if you wanted to hear from her on, how she plans to do this.
I would love to hear what your plan is, Kirsten. If you wouldn't mind grabbing a microphone so everyone can hear. Yeah, you can have a seat at the table.
I think you're good. Or no, Ken wants you to.
This started with, I obtained a CLIA waiver for the Quabbin Health District so that we could offer CLIA waiver testing. So the clinical laboratory, something, sorry, I forgot the last 2 letters. But essentially the government says, okay, as long as you follow all the manufacturer's procedures, you can go and perform that. So you're probably familiar with the point of care testing, if you do urine dipsticks to glucometer testing to cholesterol testing in a doctor's office. That's all CLIA testing. And it's waived because it's not an established lab. So we obtained that CLIA waiver, which allows us to purchase a professional glucometer and the A1C kits. So what we decided to do is go with the A1C Now, which is the least expensive, the physical machines that are not really portable and they cost thousands. So these just cost a couple $100. You get 20 kits at a time. And what we would do is at our monthly health and wellness clinic, we would be able to offer, of course, more glucometer testing. And we would be able to offer do an A1C test for anyone who wants to be it's only screening for diabetes. They sign a form that says that they know it's only screening. So what I did do is I did develop a sheet that would basically have this is what my A1C result is. You fill in, your doctor's name, their phone number. So this is the screen here. She put it up there. So essentially, it gives them the basic number, and essentially what I tell them on there, what do I do with the information? This test is only a screening. Its intent is for you to have an idea of whether or not, what your numbers are over the last 2 to 3 months, and for you to talk to your doctor to decide whether or not you need to monitor it more, you need to make any changes, you need to be treated. So, it's really specific what an hemoglobin A1C is, and it kind of just gives them an idea of oh, maybe I do need to go. I think to use an example, one of the employers in Ware, I had sat in and was giving information and helping out in one of their employee benefits fairs, and in my not mathematical estimation, at least 85% of them hadn't seen a doctor in 1 to 2 years. So this is hopefully going to prompt them to go, oh no, I need to go see my doctor. There's something we need to do. But you don't know if you don't have the information. And from there, we can give them resources if they're not connected to it.
Like what?
Depending on the number my plan is, if that number is more than 6.5, we're gonna try to call a doctor while they're sitting there with me, because I don't want them leaving and not doing anything.
Well, 6.5.
That's just on the
That's
edge.
too
I
low.
know it's-
Yeah.
Yeah, but I want that at least their provider to know that they've had like 6.5 or.
Right. So you are you going to get their fax number and fax
Oh, yeah,
that
I'm going
information
give
to
them
the provider?
information. Yeah.
Yeah.
Because it's obviously it's not a diagnosis of diabetes to get 1A1C. There's a lot more involved. So educating them on, okay, this is the number. This is approximately where you are on this, whether you're diabetic or not, pre-diabetes. There are changes you can make if you're not diabetic that may help you not become diabetic. So you need to see your doctor and see what referrals you may need to treat.
Is there going to be something other than this that you give them, like about, like?
Yeah, I'm gonna have like nutrition handouts and all the things that I can get from the, the American Diabetes Association gives out a lot of things that you can give them.
Mm-hmm.
But my point is to, if they're pre-diabetic, they have a chance not to become diabetic. And if they don't know they're diabetic and that number's in that window of being diabetic, then we can educate them on how important it is to make sure to see their doctor, to get some treatment,
Right.
to see what the recommendations are, to address their nutrition, to address all of the other factors, and give them a list of what the risks are if you're not treated.
How many people have you met with?
None so far, because we just got the CLIA waiver on May 27th, and then we had to get the pricing on the supplies and all that stuff.
Oh, so you just started?
So we're just starting. So the order's going out tomorrow to get the supplies.
But you've been doing clinics at like the libraries in each town,
Yes,
senior
yes.
center.
Yeah.
Are there many?
Not a lot of attendance yet. Not a lot of people are coming in to come in and get those resources. So I'm getting one or two each time. But doing the blood pressure screening, giving them all kinds of community resources.
Well, one of the things I had noticed though, because I see, like I think maybe you put it on Facebook for like, I know in where you do, but it will go up like when the screening's already taking place, so I think putting information out sooner than like the day of is.
Yeah, the libraries are supposed to be marketing that too. Plus I put it out in my newsletter every month.
Yeah, but the newsletter, that like social media is like a main way that a lot of people are getting their information. So if our goal is to capture the public, then that's how we get their attention, I love it. All right. Thank you. Does anybody have any other questions? So you are getting the supplies soon, and when do we think we're going to start this rollout?
I would imagine probably right around the second week of July,
Wonderful.
depending on how long it takes for the supplies to get there.
Perfect.
I do have a question. Is there any other way of advertising that before she starts the these clinics, rather than just put out the monthly newsletter and
Yeah, there's
the
flyers.
senior center, I
Library,
think.
sent the flyers up in the senior center. We put them up. I put them up at the recovery center. I've got them up at Gandara Center here in Ware has them. In Belchertown, I've got them at the senior center. I've got them at Christopher Heights. I've got them at the library. They're all over Pine Valley.
And we can also, are you all hearing our radio ads on the radio station at all? Because that's one of the avenues that we also utilize is the Classic Hits
Okay,
radio
you do.
station that hits this area. So
I listen to Pandora, so it's not on there.
Yeah. Okay. We could also put it in the paper too. I think, our.
Yeah. I just think honestly that social media is where a majority of the people are because, the thing is the people at the senior center are I'm thinking, I mean, they're seniors, they are seeing their providers because they're on meds. Most seniors are on something, and that is not a judgment call. This is just how come we get to be so old. So like, oh, I'm talking about you, Ken. So that's why I think that the social media avenue really captures the at-risk population because the people at Pine Valley are also of advanced age and seeing providers frequently. So yeah, and that's
We focus on people in their 30s and 40s.
well, because if you catch it early, by the time you're, a senior, was that in bars? I mean, I will volunteer to do the marketing.
With the
How many
budget.
bars left?
I know.
With a budget.
Yeah. Fabulous.
Oh, may I introduce Colleen Durocher, a member of the Board of Health?
Or Belchertown. Hello, Colleen.
Yep. Okay, anybody on the go-to meeting that has any questions about this new service? Just speak up because I can't see anybody right now.
All right, we will take their silence as no more questions.
Is the Ware Board of Health satisfied with this program? Is there anything else you would like to see? Because it's not going to max out our budget, so this is probably going to be less than $1,000 just
Should
to
we
do
get
this.
the A1C machine then?
We could.
Maybe we should wait and see if it's being utilized.
Yeah, but those machines last forever, and then all you have to do is buy the test strips.
Okay.
And you can share it with the other towns.
Exactly. I would be interested in seeing that because if we only have a certain amount of money to use, because this could really take off. And if it doesn't, well, we have an A1C machine.
Is that something we can order, Kirsten? An A1C machine? That's fine. That's fine.
You know what? We'll take two. Take two. No.
Okay. That'll be fine.
And then you're not limited though, right? Because then it's like, ooh, I got all these people, and I'm hopeful. I'm putting some marketing out there too. We're gonna catch this diabetes,
And
and
you're going to the bars.
you better be eating food with your alcohol if you're diabetic. All right.
Very good.
So
The next on our
what's
agenda
next, number 4.
is the member town.
Getting that capacity, we get money back every year.
Yep.
I'd like to see us buy things that we share with all the town.
I'm with you, Bill. I like
Yeah.
spending
And
money too.
keeping it, something that's not going to be
You know,
thrown away after.
Yeah. Perfect.
Digital scanner, not failed digital scanner.
Yep.
You want a scanner too?
Sometimes,
Okay.
but like you could put in, put in the whole blueprint.
I was picturing a scanner like it's.
Thumb drive, no. You know, our.
Oh, right. All right.
We'll think of it later. I mean, if there's extra money.
Well, I guess we should see. Is that a grantable purchase, a scanner?
As long as we can use it for the district,
Yeah.
I think, right? Is that something, Ileana? I'm looking at Ileana.
There's certain limitations. If it's, I think maybe 5,000 or over, state might consider it capital expense, so they might put a hold on it. But Andrea can always submit an allowable expenditure request, and I'm always supportive of what.
Well, don't you have? What do you say? You had 20,000 left for this year. Well, when's the end of the year is now, right? Isn't this how it
Yeah.
goes?
Yeah,
So the money has to be spent by June 30th.
So we're gonna have to buy a scanner soon if it's under $5,000, right? Do you think that's something we can?
as long as we get the invoice before the end of June, we're good and we can use FY25 funds to pay for it. Otherwise, we would have to
Tell the vendors.
pay for
we
it,
have to use
yeah, in FY26.
They wanna get
But I think it's still doable for FY26. I mean,
Right.
So why can't we buy the A1C machine
We're
This
gonna.
year too.
We
This
just
year.
decided to-
We're gonna.
we decided to-
Yeah.
Is it this
Just
year?
gonna do it.
We can, but as long as we get the invoice, we need to get the invoice in by the end of the year to use the funds for this. Yes. So we'll have to order
Right.
it like this week.
I
Yeah.
love it. We're building a strong district.
Okay.
Two pieces of equipment at a time. All right, next discussion. Board discussion and vote on member town assessment formula and effective date. Remember, Andrea sort of gave us a little appetizer at our last meeting about this. She showed us all of the information, I think, last time and this time. Sorry, I'm doing this, Andrea, but, just as a recap, she figured out, population-wise versus workload-wise, and we came out with where paying more than what they were, I guess, the amount of work and population in Belchertown paying a little less. So she came up with a new formula. Did Belchertown get to talk about this at their meeting?
Yes,
Do you want to
we
speak
did,
on this?
Yeah, this is Ken Elstein again. So we talked about this. Basically, the formula that's been in use now for close to 30 years was based on the 1990 census. And at the time, Belchertown and Ware had almost the same population. In that time, Ware's population has been fairly steady, as has Pelham's, but Belchertown has increased by a third from approximately 10,000 to approximately 15,000. So that's the argument here, or the point that Belchertown, therefore, has been, and it shows up in the number of inspections and stuff like that. So basically, we're working on a 35-year-old formula, which seems obsolete. Obviously, I don't like paying more.
Of course, no, neither do we.
Now, Andrea, you had also spoken to the staff in Belchertown with Steve Williams.
Yes.
And with Jill.
Yep. Steve had texted me at the Board of Health meeting because he wasn't able to attend. Otherwise, he would have attended. He's the town manager in Belchertown. He's talked it over with the town accountant, and they've accounted for an increase if we decide to do this for our 2026 calendar year. And an increase going from 50 to 57, if we had worked it out for this year's budget, would have been about a $27,000 increase. So thinking ahead to 2026, which I don't have the budget drafted yet, we're looking at almost a 30, everything kind of goes up a little bit. So they're accounting for that increase, which would be closer to like 30,000 for 2026.
And if I'm not mistaken, that was included in the budget that was approved at the town meeting.
I don't know that.
Okay.
But
it would make sense.
Right. But they've accounted for it, and there was no pushback or any.
So really, all we have to do
disagreement.
is vote on
Yeah.
redoing
I'm
the
gonna X out
percentage
of
for the
that.
member town assessments.
So I can see.
So wait,
And-
what number are we going to? 55 or 57? I'm confused.
57.
Well, on the bottom left, it's 55.
On the top right, though.
What is the number that we're voting on?
That's a good question.
It's up to you. If you wanted to, it's up to the board to decide how they want to distribute these how they want to decide on the member town assessments and what formula. So historically, it seems like it's been done based on population. I wanted to kind of do it two different ways. If you looked at the work that's done in each town, so I have it on the left-hand column. If you were to base it on the percent of work in each town, that's what it would come out to. Belchertown would be 55%, Pelham 5%, and Ware 40%. But that is going to fluctuate from year to year. So even thinking about like the pandemic, those years, it would have been probably very different. My recommendation to the board is just to be basing it on the population data.
That's a 30,000. Based on 57.
Yes.
Yes. I mean, population seems the most fair if,
Yeah.
yeah.
Cleaner, and it is what it is, basically.
So then would it have to be would you put something in like to revisit every 5 years or something, right? So that we don't end up
Yeah,
with
we'd have
this,
to, yeah. Because as you've seen, it changes.
right?
So, yes, whenever the population, when the census data comes out.
Is that like every 10 years, the census? I don't know.
Well, we would address that question in 5 years. Well, 5 years is fine. There's intermediate estimates done by the U.S. Census, and we can discuss that, which wouldn't be the next time, but it would be in 2035. But they do, the U.S. Census does have periodic readjustments, and we could discuss that if any of us are on the board 10 years from now.
Well, I think we should put something in place probably like, that we'll do the member assessments with I guess based on percent population and revisit it every 5 years? So that way.
every 5.
Yeah, so that way we kind of set it up for success for if we're not on the board in 10 years. Right.
Okay, make a motion. We've got the assessments for the next calendar year, right?
For 2026.
For the school board effective next year. For, the, based on population, so 57% of 5% where 38%. And we visit that every 5 years.
All in favor?
I'll second the motion.
All right, all in favor?
Aye.
Aye. Gail, you're an aye, or, yeah?
Yeah.
Aye.
Okay.
Don't worry.
Oh,
We've
That's
never
right.
resolved that question.
well, I don't know who's the 3 voters in your town.
Where we all vote all the time unless we have to figure it out. But when
Okay,
it's
it doesn't
unanimous,
matter.
it doesn't matter.
Thank you, Ken. Awesome. All right, what's our next thing?
We
So,
spent time discussing that, trust me.
all right, yes, the board vote to amend the employee handbook regarding wording on page 7 and 8 and 10 and 11, changing from accrued to earned for vacation and personal time. Has everybody looked at this, thought about this? Are there any questions?
Yeah, we talked about it at our meeting.
You did?
Yeah.
All right, Pelham, where? So essentially, their vacation time renews yearly instead of,
On our anniversary.
yeah, on your anniversary.
Essentially, it's just a clarification. It doesn't
is.
change policy as it's been implemented.
Right, correct, exactly. All right,
I move that we make the changes from accrued to earned as indicated on the pages.
I'll second that.
all in favor?
Aye.
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 Moving right along.
All right. Oh, this is an amended agenda item. And, okay, so vote to appoint a backup district treasurer. Our district treasurer is Ashley, and she is going to have a baby. I don't know if she's not even having it right now, because last time I saw her. And she has, our warrants and, checks and all of this. And so when she's out, you need a backup. And so the backup had typically been someone from where, but they're not comfortable doing it. So there is a treasurer from Pelham, Mary Jane, or
June Massey.
June Massey.
Yeah.
Yeah, Mary Jane or June Massey. So June Massey has agreed to fill Ashley's shoes while she is on maternity leave. But we have to vote to appoint this backup district treasurer.
I move that we appoint June Massey as backup district treasurer.
Is there
I'll
any-
second it now.
All in favor?
Aye.
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 We couldn't hear you before, Gail, and now we can hear you very well. It's great. All right, so next item, board to set up a grievance committee. This is something that makes a lot of sense because, you know, although we do have a very small district, you know, if an employee does have a grievance with, let's say, Andrea, who can they go to for that? You don't maybe want to go to Andrea. So we should set up a grievance committee amongst us, so that the employees have someone to go to with a grievance, right? Anybody have anything to?
Yeah, well, I suggest we have one member from each town,
I like that idea.
as we do, for example, for the next one, the performance evaluation, and for the officers. So we should first agree to do the grievance committee, and then we have to look for volunteers.
All right. So,
Okay, so I move that we set up a grievance committee that would consist of one member from each town, period.
all right, all in favor?
Aye.
Aye. All right, next action item. Who wants to be on the committee for each town? All right, you'll be Belchertown? You can be, okay.
And you need-
I could be where?
Okay, there you go.
All right, so you can't leave because you have a position out on the district board, so you're kind of stuck with us. Both.
You can't ever
Yeah.
leave this meeting.
You have to stay
It's
with
gonna go
us.
on.
You're part of the grievance committee. All right, so the grievance
No.
committee has been set up. It is Leonor Rodriguez, Colleen
Durocher
Jerochet,
with the
and
capital
Donna
S.
Rookie.
Thank you.
We probably should reset it up yearly, just in, because
Yeah.
we're elected officials, we're not always going to get elected, right? So there's that. All right.
Right, Jim.
Next thing will be the performance evaluation committee. Because there's a member vacancy and committee reorg. So we were on a performance evaluation committee for Andrea. You,
I was on
myself,
that.
And someone from Pelham, because we had someone from each town. So we need to redo that committee because Andrea needs her evaluation.
So are the two of us still on that committee, or do we need to be reappointed?
Well, I think we should, does anyone else want to be on the committee, let's see about that,
I mean, I'd like to serve again.
Pelham, someone's got to volunteer as tribute.
We did it last time, yeah.
Right.
Yeah.
Officers, but
That makes sense because it's the performance evaluation of the director.
right. Is that okay?
Yes.
Okay, so,
1 year,
We'll vote again in our
October meeting.
Is
Yeah.
that November meeting?
October.
October meeting, we'll vote on that. The officers for the next year.
yeah. This is my first time as the chair, so just think about that when it's voting time.
And you're doing okay. You're doing okay.
So just for clarification, the performance evaluation committee will be whoever the district officers are. So whenever those terms rotate, they'll automatically be involved in the performance evaluation committee. As of right now, it's going to stay the current officers. Jennifer is the chair, Bill the vice chair, and the secretary Ken. But the officers are going to reorganize in October. So for the 2025 performance evaluation, that'll be done by the new officers. That make sense?
Yes.
The one that is retroactive that will take place in 2026 for 2025
Right.
would be the new office.
Right. So this performance evaluation is for 2024.
Right.
Are we all comfortable with that? And then if anybody feels otherwise, we can always revisit it if somebody really wants to be on the performance evaluation committee.
Yes. Just
Let's just go ahead and vote on it. That way we don't. All right. All right, so then I make a motion that we set up a performance evaluation committee with the officers of the Quabbin Health District as the committee members, and it will change yearly.
Second.
All in favor?
Aye.
Aye. Okay, meeting minutes for approval.
October 23rd. You make it figure. You make it figure.
All right, to start this going, I move that we approve the minutes of October 23rd, 2024 as written.
I'll second that.
All in favor?
Aye.
Aye. All right. So next item, number 10 on the agenda. Administrative. What's that? Oh, okay. Try to do my best for my first meeting.
For a first time. For a first time.
All right.
Rookie.
Administrative assistant and treasurer's agent and director of public health job descriptions, revisions, discussion, and vote on changes. As we all know, Betty has served her time here for the Quabbin Health District. I wish she was here so we could give her a big round of applause and thank her for all that she has done for us. But in her absence, her position is also now not filled. Andrea has has worked with Betty to figure out what are the duties of Betty, what is it that she does. And so in doing so has come up with a proposal for us.
So you've got our current two job descriptions. One is for the director and one is for the administrative assistant and treasurer's agent. And what you will see in front of you in your agenda packet is what I've highlighted in yellow, which are proposed changes or amendments to the job descriptions. So the majority of the job description is staying the same. So what I'm proposing is for the public health director position, I'm overall responsible for the district administration, which is making sure the payroll gets done, making sure the warrants get done every week and the bills get paid. But generally that task has always been delegated to the administrative assistant. And so in that job description, you'll see that it's done on a weekly basis. And just having, learned as much as I can from, the limited time I had to spend with Betty before she retired, I think it's appropriate for me to take on that task as the director. I will be doing it anyways in the interim until we hired somebody. It isn't something that takes an enormous amount of time. Payroll is done one day a week. The warrant is put together one day a week. It is not something that is terribly time consuming that I cannot take on that task. So in my director job description, I have that responsibility rolled in. And let me get to that. And then on the administrative assistant, I did not completely take it out, but I put on there assist the director of public health as needed with those responsibilities. So if ever I was away on vacation for a couple of weeks or out sick for a long time, that we would have somebody else that is trained to make sure that the payroll gets done. The good thing about Harper's is I could do that from home if I needed to, as long as I have the time sheets and I know everybody's time. The same thing, like right now, QuickBooks is a desktop version, but if we in the near future switched to the online version, it's cloud-based. So that would be something that if I had to work from home being out for a while, I could continue that. But on an as-needed basis, I would delegate that to the administrative assistant. So when thinking about the administrative assistant job description, there's really two main roles. One is the Ware Board of Health, just like what Mary Grenier does for Belchertown Board of Health. It's that function for Ware. And then the other function is the district administration, which is some of the functions I just explained. So taking them apart really does not leave a full-time position. And we have an opportunity to rework this job description for the administrative assistant to save money in the long run for the district. If we made this an 18-hour-a-week position, just focused on the Ware Board of Health administration and on an as-needed basis helped me out with the district administration, we could save up to $50,000 in our district budget. And in thinking about the future with grant funding and some of the uncertainty surrounding public health grant funding, if our grant ever went away, we would have expenses like the $25,000 salary adjustments that we would have to roll into our district budget. And even if we wanted to maintain having, a full-time public health nurse, we'd have to roll a full-time position into our budget and salary. So if we're able to make some changes now while we have an opportunity, we could roll in some of those excellence grant expenses so that we're paying for them now, so that it's, because we still want to maintain being, I don't want to say level funded, but we want to maintain some sort of stability. We don't want to have a huge cut in our district budget. We want to keep it, relatively the same. So if we cut money from something like this position and added something in, we're still keeping it, I guess, padded, so to speak. And because we have DPH here, if the board decides to do this and, make the administrative assistant position part-time, then when I do the 2026 budget, if you wanted to roll in those salary adjustments, for example, the $25,000, I would do a budget revision for the excellence grant and take out that $25,000 because we can't have both. And I would allocate that 25 to something else, if that makes sense. I just, because, you're here and I know it's already in our district budget.
Okay.
I think this is excellent. It's a way of adding flexibility because all of the wording here changes to as needed, as I understand. Doesn't prevent anybody from doing anything, and it certainly will save money. I like a lot that you're thinking outside the box here, so I think we should approve this.
And I wonder what will it do to services in the town hall and Ware? I mean, I'm sure Betty wasn't sitting there twiddling her thumbs. You're in Pelham's office, Belchertown, you're in Ware. What happens when people come in to get permits and everything else that normally happens? I know they have to come in just at a certain time, certain hours, staffing it.
So I guess the good thing about the Ware Board of Health is that the district office is there. So the office will be staffed. I'll be spending more time there, but whoever we hire, if it's 18 hours, just like here in Belchertown, the Board of Health office is open Monday, Wednesday, Friday from 9 to 3. However, if we did that for the Board of Health and Ware, we're still going to be there because that's where the district office is. It's just the administrator will only be there for those hours on those days. I really don't see this as a decline in services or customer services. I've been in the office plenty of times and I can attest that we don't have a lot of heavy foot traffic.
Do you have to go out and do like inspections when John, is backed up or gets behind? Or I know Roger's doing all of our perk tests and everything like that.
Yeah, but I don't schedule. Betty schedules.
Betty schedules and Betty schedules that.
And then she coordinates or she was coordinating with the installer and with the engineer.
Yeah.
I don't know who's doing that now, but Betty is.
So we can continue to do that. I can continue to do that. I mean, the phone messages are checked daily. So if somebody is submitting an application or calling to schedule a perk test and they have all the application and the fee paid, it will get scheduled.
Well, I think things that I like about this are that it does save the district money, right? Because personnel is like a big expense, right? And then if it's not a full-time employee, then you're not having to put money in for health insurance or
Retirement.
the OPEB, right? Yeah, and so, and initially when I was looking at this too, like Donna, I was thinking, okay, well, hours. But if Belchertown, if we've already voted that, Belchertown is responsible for a higher amount of the workload, but they're able to still meet the needs of the public with being open. Are you Monday, Wednesday, Friday here, Mary? Yeah. It seems feasible.
I guess. I just, seems like a big, emptiness in the Ware office. Plus, if you're needed to be out there doing inspections, which is part of your job now, you're asking to take on more responsibility to be, how many places can you be in?
Well,
and if we lose the grant, then we lose Roger. We maybe lose a full-time nurse and go to part-time, because that is a huge amount of money that is spent. And I don't say that it's, not a necessity in some ways.
But that's something that we could also revisit at that time too, right? Like if that was something that we were going to keep as a district, but it's my understanding that, and if I may, that John, you're learning from Roger. I mean, obviously he's not you and he doesn't have the same credentialing. But are you a registered sanitarian? But you're going to be.
Yeah.
Right. And a registered sanitarian can do Title V inspections. That's
Absolutely.
who does it for the town of Hardwick, is a registered sanitarian.
You
and
are.
Andrea.
I'm a registered sanitarian, but to do the public health inspections, you don't need to be registered sanitarians. It's a license that you would have if you were to design plans yourself. John has his Massachusetts Title V system inspector license and his Massachusetts soil evaluator license, and that's all you need to do the Title V work, like
Right.
soil evaluations, the septic plan reviews, and the septic inspections. And he's going to be trained by a professional engineer, which is the highest level that you can
Be trained.
get when it comes to septics.
If I may ask a question, I'm sorry to put you on the spot here, John, but Donna had a question of, if Andrea may be needed, if you're unable to get, how often do you find that you're asking Andrea to do inspections because you can't get them done? I don't mean that to sound like that, but you know what I mean?
I do. In the last year, I asked her for help one time.
Right.
It was during the Belchertown fair.
Right.
All the food trucks and everything had to be inspected in like one day.
Right.
So generally speaking, I can handle the workload.
Right. And you think if you have to tread lightly here because I'm not trying to say, like, how much work can you do, John? But, like.
I am concerned that, Roger will retire at some point and the Title V work can get real busy. It's a huge time suck where you're just doing septic system work for an entire day. And we have 4 or 5 perks scheduled on one property. So you're there the entire day, which means everything else I have on my plate is pushed back, and then it's a slippery slope. So a lot of the housing work we do has to be done. We have timelines that we have to meet. So I don't know what the future holds.
Okay. But for now, you're saying, you can. My point in that question was that Andrea is not being pulled over to doing inspections right now. Hand up with who?
I had it first, but let
Oh.
Bill speak.
No, I said this was, we had a little discussion about this, and I think it's just part of the planning for contingency of losing the grants. Nobody knows what's going to happen with grants right now. I mean, they say we're going to get it for 2 years. We're not sure we will. It's on the federal level, it's kind of scary right now. You don't know what's going to happen with that kind of money. So this is part of banking a little money aside, and we can adjust again. We can always have a meeting. We can adjust the budget even, during the year if we need a meeting to do that.
Right.
I just think it's good practice to sort of make sure we can tap down and do our essential functions with, a little bit less money.
Overhead. Yeah.
And
Andrea.
the biggest part of Title V, that's like the biggest time suck, is the soil evaluations, like the perk test, because you could be there for 20 minutes or 5 hours. What Belchertown does and still has is they have a revolving fund in their Board of Health budget. So all of their fees for soil testing go into this revolving fund. And they have a cap at $15,000 where they can hire, as for the Board of Health, an independent contractor to do the soil evaluation. So part of that fee goes to pay the soil evaluator for the work, and then the other part gets retained by the town, and it's capped at $15,000. But prior to hiring Roger, they had Charlie Kanicki doing that work because Belchertown was just so busy with perk test seasons. It just wasn't feasible for the staff to be doing all of that. And that's something that Ware and Pelham, I could work with the boards of health. I mean, it's going to involve going through the finance committee and going to like a special town meeting, but setting up a revolving fund with the fees for your soil testing to go into would help, so that we could retain some sort of contractor if needed to help out with some of the soil testing in the district. That's just thinking if the grant goes away and we really felt that this position was needed in order so that John doesn't get burnt out, I'm always willing to jump out into the field and help with inspections. And I've offered him numerous times, like, let me know if you need help. I can do some of the high risk food establishments but I think that would be thinking about sustainability, something we could actively move towards.
So for the town of Ware to set up that revolving fund, is that just something that happens like at one of our meetings that we?
No.
No,
Town meeting.
finance.
Town meeting.
Town meeting.
Yeah, but I think you
But I mean, like, we would talk about it and say
Yeah,
we
you
should
make a
do
proposal
this.
and town
But if
meeting
we've already
would
got
pass it without knowing what it is.
three
They won't
people
do it.
that can do
They
it,
won't
why
do
would
it.
we want to do, I was at a town meeting and that was proposed, and we have our
Well, because
inspector.
the idea is that all we're doing is like keeping the money that we kind of
I know,
earn,
I
and
know,
rather than
moving
throwing it into
around
the general
into-
fund.
Exactly.
Yeah.
It's still.
It's forward thinking, like planning ahead for, well, that's something we can talk about later. We don't need to get you guys all.
Plumbing inspector, they're all funded that way. So, I'm not sure what they are. It's revolving.
A revolving fund. Yeah. All right.
And Andrea still has 18 hours a week to go out and do inspections, so she'll have a person there. Yeah.
Yeah.
It's
So,
like you're eliminating a job, you're just reducing. So she doesn't have to be sitting there the whole time with the assistant.
Right.
So she could help out in that.
Is there any further discussion about this motion? What we're doing right now is trying to see, if we're cool with, changing this administrative assistant job description and hours.
So I move, I don't think we've moved it yet.
Wait, our new friend.
Was looking at the reduction of hours, be able to get someone for 18 hours.
Is that like, well, we got Desiree for 18, so there must be more people out there like her.
You haven't posted anything yet.
We
Well,
haven't
'cause we had to
posted,
come up
and
with-
I mean, even with John's position, full-time health inspector, we did not get a lot of applicants. It's tough, I think, in general hiring, whether it's full-time or part-time, but there may be some like moms that want to stay home part-time but could still pick up part-time hours. So
Yeah.
I guess we'll see.
No.
Donna doesn't want it.
I don't think.
If you did it, would you still be on the board? I don't
Been
think
there,
you.
done that.
No. Oh. All right. So,
I'm going to move that we approve the changes to the job description for administrative assistant and director as presented.
second. All those in favor?
Aye.
Aye. Unanimous.
Aye.
Unanimous plus one. Okay. Next is the district, a discussion about the district officers quarterly meeting with the director of public health. So this came up, since I've been on the board, 6 years now. Big deal. It felt like we only really got to see each other once, twice a year, and we kind of get all this information. It's a big, info dump. And so I thought, what if we sort of meet like us boards, like more regularly and with Andrea to kind of like, have an idea of what's going on within the district outside of just these couple of meetings a year. And in fact, I met with Ken and Bill to sort of do a trial run, and it seemed to work well. We could all kind of be on the same page, and it felt more like there's a bug right there.
What?
There was a bug. So it kind of makes the district feel more like a, collaborative. Thank you, Ken. See, this is why we do this. And so we wanted to, bring it to the board that was, something that we wanted to do. And then also, so then we are meeting with Andrea, getting an idea, then we can have an idea of like, is it becoming too much? Are you finding that you're being pulled? Do we have to do something sooner rather than waiting till it becomes a problem? So that's, yeah.
And so the point is we're going to be meeting periodically.
Periodically, yeah.
Just the offices with Andrea.
Whoever are the office.
Right.
Change it, maybe
And sometimes maybe this will make somebody want to be an officer, right? Because then you could, meet with the other towns more regularly.
So where would the board get the feedback on what's actually discussed at these meetings, or we wouldn't?
Or
Would
At our
our
board
meeting.
meetings.
At the regular board meetings?
Yeah, so then I could come back, this is the stuff that we talked about there, so then we're all together. Yes.
Just based on my experience, believe that would be
Well,
No.
it's not a majority, right? Like there's,
No, because there are theoretically 9 members of this board, so the majority would be 5. So it would not be.
No, there wouldn't be a quorum if the officers met the 3. No,
Yeah,
absolutely, yeah.
Especially with 3-member boards, you can't do this at all.
Yeah, exactly. With that in mind, just check with the.
KP law, and then just make sure.
You can talk to, I mean, I know.
Yeah.
You call the ethics committee and ask them, because I don't want to go down a path that we shouldn't be going either.
Right.
So we could just ask that. Do you want to do it?
I can do that.
You just get in touch with them. There's usually a lawyer there. They'll either get back to you right away or they'll,
Yeah, the ethics lawyer of the day. It's an
Yeah.
800 number.
they'll either answer it right then or they'll get back to you.
Thank you for that, Rob. No, listen, hey, love it. Love the feedback.
Yeah.
Yeah. I see lots of mistakes by accident. Some of you in here. Just kidding. All right, so I guess could we maybe make a motion that we'll set this up and it can move forward, provided it passes the ethics
Yeah.
check?
Make a motion that we have periodic meetings with the district officers and the executive director, contingent on an okay from the ethics commission.
Second that.
All in favor?
Aye.
Aye. All right. Any discussion items that we didn't know prior to 48 hours before this meeting? Ken?
I would like to move that we send a letter thanking Betty for her service.
Yeah, we should probably do more even. I'll throw
Betty
in some
is
money.
not, Betty does
I
not
just
like a
never
lot
thought
of
it
attention
beforehand, No?
like that.
She doesn't want anything?
She doesn't want anything.
Okay, you know it better.
Yeah, she did say it.
She doesn't like being the center of attention. And I was like, Patty! She's like, don't you dare! And I was like, okay.
Maybe we could, flowers or something, no? Huh?
Yeah, she
Yeah.
had flowers in her office
She
today
got
from
flowers.
someone. I'm not sure who.
I mean,
I didn't read
that's
the
what I
card.
thought.
Get out of the
No,
way.
She had a nice-
She
she had a nice
I don't know. I think she made it pretty clear she didn't want anything at all. I don't know if it would just be not, like, we want to kind of, I don't know, go with her wishes.
Okay, well, okay, we'll follow her.
Well, we will make it'll be in the meeting minutes. She can see that we wanted to.
Yeah, okay.
Okay. Anything else while we're here? No?
We're done early?
You see what happens?
I know, if I was
Even
doing all the
with some
talking,
technical
we'd still probably
difficulties.
be,
Really.
going after.
All right, well then can I make a motion that we close this meeting at 7:49 PM?
You can make the motion.
Will you second it?
I'll say.
Okay, all in favor?
Aye.
Aye.
Ahead of time.
Gail, have a good night.
Aye. Good night, everybody.
Thank you.
Now you have experience.
Huh?
Yeah, so come October, I'll just be gone.